So today we'll discuss about. So today we will discuss about the microcyclic lactones, or they are also known as the macrolides antibiotics. So the coming to the macrolide endectocides means the endectocide means they are effective against the external parasites and also the internal parasites. So are the antibiotics produced by the Streptomyces microorganism, and they have very large complex of microcyclic structures. Of course, we have learnt it already, and active against many internal, mature, immature nematodes and external, that's the arthropods, and called as the endectocides. So these endectocides do contain two major groups. Example, that's the AVERMECTINS and MILBEMYCINS and MILBEMYCINS. So MILBEMYCINS or the MILBEMYCINs. So this is the category. Then coming to the first category, that's AVERMECTIN. These are closely related antibiotics that's isolated from the soil microorganism, that is Streptomyces avermectalis. So then these most of these are very highly potent and one of the most commonly used antimicrobial anthelmintic agents. Of course, the ivermectin, even now it's also used against the coronavirus especially. Then these are not activity against the platyhelminth like the tapeworms and flukes. So these are only effective against the roundworms, that is the nematodes. So ivermectins in commercial use are the ivermectin, then ABAMECTIN, and DORAMECTIN, APRENOMECTIN, and the SALAMECTIN. So these are the group of the drugs, examples of this category. So coming to the chemistry of this thing, a very little, nothing more. So these are the natural products isolated from the Actinomycetes, Streptomyces avermectalis, and this is a mixture of major components, that is ivermectin 1A, 2A, B1A, and B2A, and 4 minor components, that is A1B, 2B, 1B, B2B, and B2B. So this among all these things, B1A component is recovered in greatest quantity. And the different ivermectin anthelmintics. So these are all the combination of either A1 or the semi-synthetic derivative. So coming to the mechanism of action, in a very simple way, what we can say is they act by binding to a special type of the glutamate graded chloride ion channels or the receptors found in the susceptible nematode and arthropod nerve cells. So nerve conductivity blocking agents. And the drug binding opens the chloride channels and triggering chloride ion influx. So hyperpolarization occurs because of the chloride ion is gushing inside the cell. Hyperpolarization occurs. Then there is increased intracellular chloride ions, and this causes the hyperpolarization of the parasite neuron and prevent initiation and or the propagation of normal action potentials. So ultimately, what is the net effect is the parasiticidism. So it is going to kill the parasite. So it is going to bind with that of a glutamate gated chloride channels receptor. Then because of this one, there is inward movement of the chloride ions inside the helminth cell. Then this causes the hyperpolarization, and ultimately there is paralysis and death of the worm. Apart from this one, there is another mechanism, that is disruption of reproductive functions in ticks, also been elucidated with ivermectins. And ivermectins, as originally believed to be primary actions, of course, that glutamate gated chloride ion channels, and they have got very high affinity to the GABA gated chloride ion channels also, especially in nematodes and insects. So, however, the GABA receptor mediated hyperpolarization is of minor importance. Then ivermectins and milbemycins are not active against the cystores, as it is already told. The reason is these lack the receptor at glutamate, and the absence of AVERMECTIN sensitive glutamate gated chloride channels in mammals, and they have got the low affinity of the mammalian GABA receptors to macrocytic lactose. So they have got very low affinity towards the particular site. So further blood-brain barrier and reach CNS, where the mammalian and MILBEMYCIN safe in mammals. So usually the such type of the channels and also the receptors are present in only the parasites, but not in the host. So further blood-brain barrier and reaching the CNS in case of the mammalian CNS, it's not very less. That's why they are safe in the mammals. Then development of resistance is also, of course, it's less common in some of the nematodes, and alteration in the genes and code ATP dependent P glycoprotein that bind and ivermectins or changes in component of the glutamate gated chloride channels, because they are primarily associated with development of the drug resistance. So nowadays, since it is very widely used anthelmintic, and there is a chance that the drug resistance is very, very high, and it is due to the encoding of ATP dependent P glycoprotein transporters. So here the mechanism of action is dealt in a diagrammatic manner like this. Here, this is a pre-junctional neuron or interneuron terminal, and here is the glutamate, which is released after the exocytosis of the vesicles. Then apart from this one, the glutamate gated or GABA gated chloride ion channels will be opened by specific binding of the ivermectin on the particular site. So what happens is, whenever there is a chloride ion inflow very, very high, so then what happens? There is a flaccid paralysis of the worm, and hence the worm get paralyzed. Then apart from this one, there is a reproductive breakdown is also present. Then ivermectins and milbemycins are not active against the cystores because these parasites like the receptors, especially chloride gated receptor. So blood-brain barrier, of course, is difficult to reach, and the ivermectin is the first agent and obtained from the streptomyces species and macrolide anthelmintic, and it's a semi-synthetic agent derived from the natural AVERMECTINs, and it occurs as of white to yellowish powder and is highly lipophilic in nature. So it is very poorly soluble in water, but is soluble in case of the propylene glycol or any other vegetable oils. So the chemistry already is said that the semi-synthetic agents B1A and B1B ivermectins compounds are there, and the clinically available ivermectin is containing more than 80% of the B1A, and the remaining 20% is B1B. Coming to the anthelmintic spectrum, these have the wide range of anti-nematodal action, and large and small strongyles, ascarids, pinworms, hookworms, heartworms, and many more. So it is useful against varieties of the roundworms, and especially it is against the immature Dirophilia immites, which cause the heartworm disease in case of canines. So it is also effective against the cattle grubs or suckling lice, mites, and also the pigs. Then coming to the kinetics, the ivermectin is very well absorbed. That's more than 90% from GI tract after oral administration in very simple that's of the stomachs. Whereas in case of ruminants, it is moderate to 25 to 30% only due to the inactivation of the drug in the rumen. Most of the drug get inactivated, and parenteral administration results in, especially subcutaneous, higher bioavailability, but the rate of absorption is slower than after oral administration. So this is very much surprising because whenever you administer subcutaneous, there should be higher concentration. But the specialty of this drug is the rate of absorption is less. Then once in circulation, ivermectin is well distributed to most of the tissues except the CNS, central nervous system. So in the central nervous system, that's the GABA mediated chloride channels are there. And hence, because of this thing, it is not, of course, if it is not, as it is not passing through the blood-brain barrier, it is not having the mammalian toxicity. Then the collie breed of the dogs allow more penetration of the ivermectin into the central nervous system when compared to the other breeds. Hence, they are more susceptible to the toxicity. So it is contraindicated, especially in the collie breed of the dog. And metabolism is by liver and excreted through the feces. So there is no urinary excretion. Hence, ivermectin in soil degrades at a much slower rate, which has been shown to suppress the larvae of some of the dung to breeding insects, especially the dung beetles, etc. They are going to die. Ivermectin has a long half-life in most of the animals, that is 2 to 7 days. Means if you repeat the injection once in 2 to 7 days, it's enough in different species because it has got the enterohepatic circulation. Side effects, it is the having very high margin of safety, that is the therapeutic index is more than 30, especially in cattle, means the 30 times of the normal dose the animals can tolerate. In horses, swelling and pruritus at ventral midline may be seen about the 24 hours after ivermectin dosing to a hypersensitivity reaction because of the dead parasites. So there is a swelling may arrive, especially in case of horses. And in dogs, toxicity is predominantly seen in case of rough-haired woolly breed because the blood-brain barrier will permit the ivermectin into the central nervous system. And the toxic signs in case of dogs, so what happens? The mydriasis, pupillary dilatation, then there is salivation, ataxia, then tremors, paresis, then sometimes the stupor means the excited status, then the recumbency, and ultimately coma, and sometimes it may lead to the death also. So in case of woolly dogs, don't use this ivermectin for any other reason. Dogs may also exhibit a shock-like reaction when ivermectin is used as the microphilidae infections, especially hypersensitivity reactions to the dying parasite. And the neonatal pigs are also more susceptible because the blood-brain barrier is not well developed in this species. Whereas in case of if you administer ivermectin in birds, they will have a lot of lethargy and sometimes the anorexia also. So one need to be careful. Then coming to the treatment of overdose. So it is just symptomatic, no specific antidote is there, but sometimes the parasympathomimetic drug, that is the physostigmine, may provide some relief for dogs, some from the severe ivermectin toxicity. So whenever there is a overdose or other thing, that we can use physostigmine. Then contraindication. So as usual, it is it should not be used in collie breed of dog or collie mixed breeds unless there is no other alternatives are used. So it is not recommended for cows less than 12 weeks less than 12 weeks or 2 to 3 months of age, and puppies less than 6 weeks of the age. So in both of these things, one should not use. So the ivermectin to be used in case of the cattle should be injected only subcutaneous, and IV or IM injection should never be administered, because IM injection causes severe pain and irritation, whereas the IV administration may result in syncope of the animal. So in case of horses, the ivermectin need to be administered only orally, because they are the monogastric animal and there is very good absorption of the drug. So one should not use irrationally. So the ivermectin, as usual, it is not showing any drug interactions with the commonly used drugs. So this is one of the most commonly used endectocide in veterinary practice. Of course, it is also effective against the roundworms and the external parasites like the ticks and lice, and also the biting flies. So it is used against the GI roundworms and lungworms, especially in case of the horses. Of course, the bots, it is also effective. So it is used as the ectoparasiticide against the mange mites, that is also the lice and grubs and the horn flies. So even including the flies also, this is effective. And you can, here you can see, you can generalize the dose of the ivermectin as 0.02 milligram per kg. Once dose to be repeated, it is usually 12 to 14 days. Once in 12 to 14 days, it need to be repeated. That's why it stays a long time in the serum of the animals. Half-life is very, very high. Then prevention of heartworm, it should be used very less, that's 0.006 milligram per kg, or else it is 0.2 milligrams per kg subcutaneous. Oral or subcutaneous, it is the same. So here many types of the ivermectin tablets are available, like Neomec, then the high-tech, it is from the Virbac. Many preparations, almost all the veterinary pharmaceuticals do have the preparations of the ivermectin. So you can go through some of the books for the trade names. Then the next drug is the ABAMECTIN. So it is a naturally occurring ivermectin isolated from the fermentation product of the same this thing microorganism, that is the Streptomyces avermectalis. So Streptomyces avermectalis. Whereas all the properties of the drug is equivalent to that of the ivermectin, but it is consisting of two AVERMECTIN components, more than 20% of B1A and less than 20% of the B1B, as usual in case of the other ivermectins. And ABAMECTIN is an endectocide with activity against the both nematodes and arthropods. Arthropods, already you know that the arthropods means the insects which have got the 6 legs or more. Then cattle, the use is to control adult and larval GI nematodes, of course the lungworms and lice, mites, warble fly, etc. and also the ticks. Then horses, it is need to control large and small strongyles, and also the acaricides, then pilworms and some of the other internal parasites. Whereas this ABAMECTIN is more toxic when compared to the regular ivermectin. This dose is same, that is 0.2 mg per kg orally, not the subcutaneous route is not there. And DORAMECTIN, it is recently introduced drug about 2 or 3 years back, and it's a biosynthetic agent isolated from the soil microorganism, that is the Streptomyces avermectalis. So this is differing from the ivermectin and abamectin in having a cyclohexyl substituent in C25, that is the position. Then usually what happens is it is related pharmacologically to ivermectin and acts as the end acto site, that's the doramectin. It is costlier than that of the ivermectin, whereas nowadays it's very commonly used by the veterinarians because of its very wide margin of the safety. And this may be indicated in pregnant animals also. So the control in case of the intestinal roundworms, lungworms, eyeworms, that's the Thalagia rhodesi, then grubs, mites, lice, hornflies, and warble fly larvae. So the action is very similar to that of the ivermectins, and it is actively persists for several days and protects cattle against the infection with the Ostratagia up to 21 days. It's a very big period. And doramectin is used as the endectocide in case of sheep and swine, but not recommended in case of dogs due to high incidence of toxicity and fatality. So it may be a good agent, especially the recently introduced agent, but has got very high systemic toxicity in case of the dogs. So in case of dogs, you have to go for the ivermectin subcutaneous injection. Then the dose is same, 0.02 milligram per kg subcutaneously. And the topically also this can be applied at the rate of 0.5 milligram per kg as 4-on preparations. There are varieties of the 4-on preparations are there, and they can be used against the ticks for the eradication process. Then AVERMECTIN is almost all the similar properties to that of the ivermectin, but it has a very excellent activity against variety of bovine, GI roundworms, and lungworms. Then it is an endectocide and has got very high affinity against chewing and biting lice. Then it is also effective in managing the mites and also the cattle grubs. Then the AVERMECTIN is applied topically and is not recommended for the oral or IV routes. So whereas the abamectin, then AVERMECTIN can be used orally also, whereas this agent is not recommended for oral or IV route, only subcutaneous route. So after topical application, AVERMECTIN is absorbed rapidly and reaches the peak plasma concentration, but it takes 2 to 5 days of the treatment. It is not metabolized in a greater way, especially in the liver, and it is excreted as unchanged drug in case of the dung or feces. Then there is no adverse effect at the recommended dosage like 0.5 milligram per kg, and also applied topically by nowadays it's an era of the 4-on preparations, 4-on along a long back line in a narrow strip from withers to tail. So the withers, especially between the horn to the tail, you need to administer this particular drug. Then selamectin is a recently introduced semi-synthetic ivermectin, and it is produced as a fermentation product of the Streptomyces ivermectin, same microorganism. Then later, chemically, it is selamectin is modified. The pharmacological properties are similar to the other ivermectins, but is used only this selamectin is topically. One need to highlight this thing. The half-life after topical application has been reported to about 11 days and 8 days in case of the cats. So dogs, it is 11 days half-life. So most of the ivermectins do have the long half-life because of the enterohepatic circulation. So it is comparatively safe. So even in the collie dogs, in which this ivermectin is contraindicated, this drug can also be used, even to the kittens also. So it may be also used in case of the breeding dogs and cats and in the pregnant animals, whereas the ivermectin is not indicated in pregnant animals. And the selamectin is currently approved for use in case of dogs and cats to control both internal as well as the external parasites. So the indications of this selamectin is against the heartworm, then hookworm, then the roundworm or pinworm. So it is very effective against the various ectoparasiticides, including the flea, ticks, and mites. Whereas the selamectin is applied topically in a spot at the base of the neck. So selamectin is available as 12% spot on preparations. Then it is marketed as 6% or 12% topical application. Usually the 12% is very common in the large animal, this small animals. So dogs and cats, the dose is 6 milligram per kg. It is applied topically, but it is absorbed through the skin. Then MILBEMYCINS, yes, I will take 5 minutes rest. Okay, stay online. 5 minutes rest. Yes. Yes, coming to the milbemycins. Milbemycins are the group of macrocyclic lactones that are structurally related to the ivermectins, but they lack the C13 disaccharide, that's the substituent, and they are potent endectocytes with the mechanism of action which is very similar to that of the ivermectin. And currently, two milbemycins are there: milbemycin OXIME, then oxidectin are both of these are marketed in the veterinary practice. So coming to the milbemycin oxime, it is derived from the Streptomyces lacrimosus. So it is commercially available as the milbemycin oxime, then which consists of the 80% milbemycin, oxime A4 and 20% the A3. Whereas the anthelmintic spectrum of this milbemycin, which is a very broad spectrum endectocytes. So broad spectrum endectocytes. Then these agents, especially these are active against the hookworms, or else what we can say is, instead of telling all these things, heartworm, etc., they are roundworms. Totally, they are effective against the roundworms like the trichuris, then Toxocara, Dirophilaris. So as an ectoparasite side, it is active against some arthropods, particularly the dimodectic mange, which is effective. Then coming to the pharmacokinetic, it is lacking, especially in case of the domestic animal. So it is administered orally and considered effective for at least 45 days, especially after infection with Dirophylaris larva. So this is very good property of this drug, and the most of the milbemycins or the ivermectins, so they are also having some anti-viral activity, and in general the pharmacokinetics appears to similar to that of the ivermectin. And side effects of the adverse effects, and this milbemycin oxime is well tolerated in dogs and cats at the recommended dosages, but in case of colibrids of the dog also, it is not, especially non-toxic and recommended. Whereas sometimes toxicity may be result in the ataxia, trembling, but it is symptomatic treatment need to be done, especially in the case of the severe circulatory collapse. Immediately you will not need to administer the adrenaline and the life-saving drugs. Then contraindications. No absolute contraindications of the milbemycin oxide, and one of the safe drug, especially in case of pregnant and lactating. So there is no withdrawal period also. This is the milbemycin. So, but it is at present it is not so commonly available in India is concerned, but it is one of the safest drug, and the drug interaction is not noticed in this drug. The clinical use, as usual, it is used for the dogs for the prevention of the heartworm infections, available as the tablet, and also used for the cats, especially in case of the Dirophilaria infection and treatment of the Toxocara cati. Whereas the dose for the prevention of heartworm and treatment of the GI nematodes, 0.5 milligram per kg, once monthly, it is enough. So that's why the very long half-life is there. So it is available as the Milbegard. That is the milbemycin oxime is there, which is the tablets will be having some good flavor to attract the dogs. Then the moxidectin, it is recently introduced into the India is concerned. It is available as semi-synthetic anthelmintic obtained from the nemadectin, a fermentation product of the Streptomyces cyanogriseus. Then it is structurally and pharmacologically similar to that of the milbemycin. Pharmacology. Then the moxidectin is a broad range of activity against the nematodes, then also the ectoparasites in dogs, cattle, sheep, and horses. So it is active against the GI roundworms, then pinworms, lungworm, then the heartworms, then also the cattle grubs, mites, lice, and almost all the roundworms. It is highly effective. then it is persisting for a long time in the tissues. So it is highly lipophilic than other macrocytic lactones. So it produces lethargy, vomiting, and it is non-toxic to coli. So only ivermectin is toxic and it should be avoided. So the dog heartworm infection, especially, it should be tested, because it may cause sometimes allergic reactions. Also, the moxidectin is not approved for use in food-producing animals like sheep, goat, and cattle, and less than 8 weeks of the age. And dose, of course, the same 0.2 milligram per kg in almost all the animals except dogs. It is 0.003 milligram orally. In case of cattle, subcutaneous injection is administered. So the imidazoles, like the third group is the imidazole. So it is developed primarily for the GI nematodes, especially in case of cattle. The examples are the tetramisole, levamisole, butamisole, etc. So coming to the first agent, that is the tetramisole. So that is the imidazole anthelmintic, introduced into the market in the early 1960s. Then now it is a mixture of two optical isomers, levo and dextrorotatory forms. So the tetramisole is available in varieties of the trade names. Then it is entirely due to the anthelmintic activity is levo form, not the dextrorotatory form, and it is called as the levamisole. The dextrorotatory isomer, it's called as dextramisole, has no anthelmintic activity but has very high significant toxic potential. Then coming to the levamisole, of course, it's the L isomer of the tetramisole. So it has great safety of margin or margin of safety than the racemic mixture of the tetramisole. And it is available commercially in two salt forms and the hydrochloride. Whereas the levamisole, it's once upon a time, it was one of the most popular anthelmintic, levamisole, because it was used as the immune stimulating agent. Then the levamisole hydrochloride occurs as a white to pale cream colored odorless crystalline powder. And levamisole is highly soluble in water, so it can be used as the injection. And usually it is an injectable anthelmintic, but cause lot of side effects in case of the domestic animals. Then mechanism, it is the acting on the autonomic ganglionic stimulating agent, especially the cholinomimetic agent in case of the worms, and causes the activation of the parasympathetic and sympathetic nervous systems. So this causes the sustained muscular contraction in the susceptible nematodes, especially this causes sustained muscular contraction in the susceptible nematodes, resulting in the muscular paralysis. And these effects are considered to be nicotinic-like action. And at very high doses, the levamisole also interferes with the parasites carbohydrate metabolism by blocking the fumarate reductase enzyme. So apart from the autonomic ganglionic stimulant action, it's also going to block the fumarate reductase and the succinate oxidase enzymes. So here is the diagrammatic representation how it's going to act. So the primary action is of the levamisole is it is going to act on the ganglionic and acetylcholine receptor ion channels. So because of this thing, the ion channels are going to open and there will be influx of the calcium. So a lot of influx of the calcium causes the depolarization. Then this causes the spastic muscle contraction in case of the nematodes, and inability to remain in its habitual location causes, then especially in the intestine. Then nematode is expelled out of the body. That's how it is going to act. And whereas it is also going to block the fumarate reductase enzyme and hence inhibition of conversion of fumarate to succinate. and the energy production will be hampered. That's why the worms are going to die. Coming to the anthelmintic spectrum, it's a broad spectrum. Anthelmintic effective against the adult and larval roundworms of the lungworms, especially in case of the cattle, sheep, goats, swines. And in case of cattle and sheep, susceptible parasites include the most of the roundworms, especially the Haemonchus, starting from Haemonchus to the Dictyocalus species. And in swine, levamisole is active against the Ascaris lubricoides and intestinal threadworms, lungworms, nodular worms, and kidney worms also. So in case of dogs, so it is against most of the GI nematodes. But in case of horses, it is having very high toxicity and not recommended. So in case of horses, so try to use the most of the drug with lot of caution. So against tapeworms, fluke, and protozoa is used. And another activity of the levamisole is it is a potent immunostimulator, immunostimulatory action, and it stimulates cell-mediated immunity by the increasing differentiation of T lymphocytes. So CMI, it is going to increase the cell-mediated immunity. Then parasitic resistance is also a common problem. As usual, it is a growing concern, but nowadays the levamisole, use of levamisole is not so very common. Hence, the rotation technique need to be used. So it is very well absorbed from the GI tract after oral administration and the skin. So once in good blood, levamisole is distributed throughout the body and metabolized in liver and excreted in urine with that of the drug. In case of levamisole parenteral route, especially that subcutaneous, is effectively absorbed with peak plasma concentration in less than 1 hour, but it is little bit irritating drug with which has got lot of irritation properties. Then elimination of the drug takes place in 2 days complete. So no residues of levamisoles are detectable in tissues after 7 to 8 days, means withdrawal period is 7 to 8 days. Side effects is having the margin of, it's having very narrow margin of safety, that's therapeutic index is 5 to 6, whereas the ivermectin is 30. The muscarinic and nicotinic cholinergic signs like the salivation, then the dilatation of the pupil, muscle tremors, etc. are seen. So the death sometimes due to the overdoses causes the asphyxia in case of the animals, and symptoms of the levamisole overdose are very similar to that of the OPC compounds, and hence it can be treated accordingly. Lot of pain and inflammation at the injection site it causes. So the horses should never be administered with levamisole, and intravenous administration is very, very hazardous. And many times, please remember here, the levamisole injection was used to kill these stray dogs once upon a time, about 10 years back, whenever it's alive. But it's highly unethical to use the agent for euthanasia. Whenever the drug, especially a 2 to 3 ml fast IV was sufficient to euthanize the dogs. That's the indiscriminate use of the levamisole. Then treatment of the toxicity of levamisole, and it is with a lot of supportive and supplementary therapy, and the atropine sulfate should alleviate acute signs, and hexamethonium, a ganglionic blocker, can also be inhibit the action of the levamisole. Contraindications, especially the precautions, yes, it should not be used in case of the horses. Then IM injection causes a lot of pain, and the renal and hepatic impairment is not indicated. It may cause sometimes the idiosyncratic reactions, especially in certain animals. Then while administering this drug, the operators should wear protective clothing, and especially some of the cautions. need to be taken. So drug interaction and so varieties of this levamisole and imidazole should not be mixed with nicotine-like compounds such as the parental, morental, and DEC. So administration of levamisole within 14 days of the treatment with OP compound may lead to enhanced toxic potential of both the drugs. And severe fatalities may also occur if the levamisole and chloramphenicol if they are used simultaneously. So one need to be very careful while administering to these drugs. And in case of the filariasis, this drug is used as immunostimulating agent. And the combination of tetramycin and levamisole produces the additive side effect. Uses: it is used for the cattle, sheep, goats, and swine, poultry for the treatment of the nematodiasis. Also, it is used in Diarofilaria immitis, microfilaria infections. Then it is used as bolus, drench, or feed additives, and also the subcutaneous injection. The dose of this drug in 7.5 milligrams subcutaneous or oral, whereas 10 milligram per kg topically as poron preparation. So ectoparasite cells can also be used, whereas the dose is same, of course, 7.5 to 10 milligram per kg. Butamycol is another congener of the derivative of levamisole, and it is injectable imidazole with mechanism of and properties similar to that of the levamisole. And it has been used mostly in case of dogs to trip the whipworms. Dogs, the dose is 2.2 milligram. And tetrahydropyrimidines, yes, we will learn this thing in the tomorrow's class, tetrahydropyrimidines.